Now I would like to take some minutes to talk about project portfolio management. Because when you have a firm, you might have several development projects going on at the same time. And when you think about R&D strategy, you need to be able to choose between these different projects, and you need to be able to handle these different projects. And I'm going to talk about project portfolio management using one example. And I'm going to use this portfolio manager, Stephanie, who is at a large pharmaceutical company. This is based on a true person. It's not my material. I've taken it from a book, but this is a picture of what it might look like. And Stephanie, she has a portfolio of 60 to 80 projects in different phases, and they develop medical products at her firm. And their resources are limited, and they are perpetually making decisions on priorities, and especially on whether particular project should be dropped or not. That is go, no-go decisions in the tollgate. And the decision process is very complex. They take account of several things. They look at the market conditions, the likely time to market for the product that is being developed, the commercial valuation, how much money is it likely to gain this product that is being developed, the likely speed to completion, when will the product be launched, the risk that viable products is not produced, meaning that the thing that is produced based on this development product will not pass the trials, medical trials, and will not be a product that can be put on the pharmacy shelf. The probable return of investment. They look also at the length of time we may exploit the product. When will something new replace this product? How long will we make money out of it? Is the competition before or behind us in this? Will the competition beat us to this, and then we might not make so much money? So they take this into consideration when they decide whether or not a project will be terminated or not, and whether or not it will proceed to the next gate. When they have this portfolio of different projects, they also try to maintain a balance of projects. They try to have high and low risk projects, short and long-term projects that are short, and projects that take long time. And they often decide to terminate a project, and that can take place in all phases of the development. The termination can depend on changes in the market or in the project itself, and they use the stage gate to evaluate the projects, and they continuously make risk evaluations for both project and market. And despite having all of these structures and these ways of evaluating things, they still have problems with the quality of their real-time info. And despite their intensively analytical approach, they still have to make enormously important decisions that are worth millions of pounds on a gut feel basis. And that is what separates them from their competitors. And that is what the senior managers get paid for, that they have this gut feeling. And if they get these decisions wrong, they don't last very long at the firm. That is what Stephanie says, product portfolio man. And in the case that we solve in this course in one of the workshops, we talk about deciding between projects. In that particular example, we only have 2 projects to decide between, because it's a smaller firm, but in a larger firm you can have several. Smaller firms have a power advantage sometimes, and this is a guy who I interviewed. He's a physician and professor in clinical pharmacology, and he started a business, and he says that they were able to skip phase 1 tests and test the configuration of the drug on ourselves. This since we are physicians who sort of know which risk there is. So we blocked our own cortisone with strong steroids and measured this. In that way we saved 20 years. Then we could head straight to the patients. So they kind of did it in a different way than a large pharmaceutical company would do. So sometimes it could be good to be small and not have that many rules. I don't know if this is allowed, but apparently that's what they did in when they developed this drug. And big companies have understood this. They know that it is hard to be innovative and hard to be creative when you are large and have large bureaucracy. And therefore, one strategy for big business has been to work with startups. So big companies have their own accelerators or incubators. An incubator, that is a organization who helps new entrepreneurs or new people within a business to get the competencies and to know what they need in order to be successful on the business. So it's basically a way to get some training. And you could also call Drivhuset that we have here in Uppsala for students a kind of incubator or accelerator. It's for students, helping students who have business ideas to kind of get equipped and get competencies needed in order to take it to the next step. And one example of this is E.ON, who is a big energy company, and they work with startups by having an accelerator, and you get to apply to that, and if you are accepted, they give the company 30,000 euros. They also give them a 6-month business development program, which is the incubator accelerator then, and access to E.ON's experts, so they get a network and they get access to competencies that they might need.